Hello, Community Clinic staff advocates. Long time no talk. This is Soren Chanel with the Community Clinic Consortium, and I'm sending you this email and video clip today because it's been a couple weeks since I last reached out to all of you on the topic of national healthcare reform, and in part that's because it's been a really frustrating last couple weeks for the cause. As many, if not all of you know, the Democratic Party took a big moral and political blow when they lost when the Massachusetts seat formerly held in the Senate by Ted Kennedy was lost to a Republican named Scott Brown, basically sort of running the Democrats' political supermajority into a wall and robbing them of the ability to break filibusters in the Senate. And what that's unfortunately done is also delivered a big moral and political blow to the cause of healthcare reform. So for the last couple weeks, unfortunately, no one has really known what's next or what direction Congress and the President want to head on moving healthcare reform legislation through the process. And so it's interesting to me that it kind of feels like right now it's going to be up to us, the grassroots, the people who deal with the broken healthcare system every day, to reinvigorate our politicians in Washington, D.C. You know, when Barack Obama was running for president, it seemed like a lot of what he did was he fired up the people throughout the country. Like, he fired up the grassroots. It was his leadership and a lot of his calls that got people stoked to unite behind his vision. I feel like the tables have turned, the responsibilities have turned, so that it's really on us now, the people, and again, the people who are working in the trenches in the healthcare system, to fire him up and to fire Congress up to get them going again on healthcare reform. And so pretty soon I'm going to be visiting your clinics with the permission of your clinic managers, and hopefully bringing a postcard campaign to your sites. We're going to coordinate with community clinics throughout the entire state of California and send as many thousands of postcards demanding that Congress move forward on healthcare reform into both our senators and our congressional representatives. So it may not sound like a big deal sending postcards, but we're hoping that with the huge numbers that we're hoping to get of staff and patients, that it really makes a big statement to our elected officials that they can't just stop now, that when the going gets a little tougher, they can't give up on healthcare reform. We've come so far, and there's so much at stake for community clinics and for our patients and for the healthcare system in the country altogether, that we really have to push forward now more than ever. And so stay tuned for that. I will be visiting you in person sooner rather than later. For now, know that we're hoping to push forward with healthcare reform and hoping to have it done this year, but it's looking like now is the sort of do or die time. So thanks very much for your continued interest and advocacy, and like I say, I'll be in touch quickly. Thanks. Bye.